Welcome to Medicare School Daily. We're excited to be with you today. This show is brought to you by MedicareSchool.com. We're an insurance brokerage that really just focuses on education. I love to help people with all things Medicare. Today, my dad is going to do some teaching today, and we're going to be talking about what happens whenever you're already taking Social Security and you turn 65, because that's a different kind of enrollment path with a different set of options versus if you're not on Social Security. So we're going to talk through all that today. If you guys want to be on today's show to ask a Medicare question or a Social Security question, we'd love to hear from you. The phone number is down here at the bottom of the screen. It is 833-824-2004. 833-824-2004. You can call in. Don't worry, we're going to scrub any personal information, so you don't have to worry about that. But we'd love to engage with you, answer your questions, and hear your Medicare stories as well. My name is Josh Music. My dad here is with me. His name is Marvin Music. We've been helping people with Medicare for about 15 years now. So while we don't know everything, there's probably not many situations we haven't seen. So love to talk with you and help you through your needs. Okay, before we hop into that training, we're going to take our first caller. We've got some people parked on the line, so let's get to it. Hello, welcome to Medicare School Daily. What is your name and where are you calling from?
I'm Brad. I'm calling from North Carolina.
Brad, I feel like we talked to a lot of people from North Carolina. Thank you for joining us. What's your question?
That's where we
go ahead.
To retire at.
Yeah, well, it's a better place than Kansas, that's for sure, or Missouri.
Oh my goodness, yeah.
Yeah, hey, you don't have to insult us. This is where we've lived our whole life. No, awesome. Wonderful to talk to you. What's your question, sir?
My question is, your team actually helped me get through Medicare. Actually started in November and it starts April 1st. So thank you to the team for that.
Sure.
I just retired last week and I'm 65. I turned 66 in November.
Okay.
And I'm still probably want to go back to work next year. So my question is how much can I earn from January to my birthday, November, which is my full retirement age?
Okay, very good.
I've heard two numbers: the 24,000 or the 65,000.
Okay, I can tell you. Do me a favor, make sure I'm right, Brad. What is your exact date of birth?
November 13, 1960.
Okay, very good. 1960. Okay, so your full retirement age would be 11/1 of 2027. All right, so here's what's going to happen. This year you are quite limited, but next year, and I think that's what you're asking for. In January, is that your question? How much can you make next year?
Yep, from January to November, which then I'll turn 67 in November.
Exactly right. So the year that you turn full retirement age, that amount goes to $65,160. And it's an annual amount, but the truth is, if someone, let's say they were for you, you can do that in 10 months. So as long as you stay below during that 10-month window, below $65,160, there'll be no impact to your Social Security check whatsoever. If you're going to be above that, as you estimate your 27 earnings, for every $3 above, they'll actually take $1 out of your Social Security benefits. Okay, $65,160 the year you turn.
But so that's about $6,500 a month because it can be divided by 10 months, you said?
That's not the way they do it. It's an annual amount.
Okay.
The only time that they look at the monthly amount is when you're retiring that year. And so if your annual amount is going to be above that amount, then they'll take it and break it down by the month.
Okay, so it's $5,400 a month-ish. Is that right?
Yeah, but for him, it will be an annual amount because you're going to take your Social Security benefits this year, aren't you?
Yeah. Correct. I'm already on it. Yep.
So the monthly amount will not apply to you.
Okay.
Yeah, it only applies the when you first take. Yeah, because what they do, and they're giving people the benefit of, they give them the best option. So if I've made more than the annual amount, but I was still working, it's fine. Then they'll then look at the monthly amount for the remaining months of that year.
Okay.
That's the way it works. So once he'll be already on Social Security next year, so his limit will be $65,160. But he can do it in those 10 months.
Sure.
It's not a monthly amount then.
Okay.
It's an annual amount. So point is, let's say someone was going to take in March, they can still make $65,160 in January, February.
Okay.
Yeah.
Wow.
Yeah.
Okay.
So it works. Yeah.
So $65,000. What can you make this year?
$24,480. $24,480 this year, and so he's obviously above that. But they won't hold that against him if then the remaining months divide that by 12. They'll look at the monthly amount then, which is a couple couple grand.
Sure.
Yeah.
Okay.
Yeah. So the only time they look at both options is the year you retire. But after you're retired, it's the annual amount.
So 24,000 this year, 65,000 the next year. What about the year after?
It's unlimited. Once he hit 11,
Yep.
2027, he can make as much as he wants. There's no bearing at all, no penalty at all. Yeah, and I want to remind everybody, we're only talking about wages. We're not talking about, it's earned income. We're not looking at, pension income, annuity income, Social Security. None of that counts. Only working wages. Net self-employment income, W-2 income, 1099 income.
Okay.
Yeah, that's all that counts for the for the earnings test.
Okay. Brad, what other questions you have?
That's it. You answered it perfectly. Thank you very much.
Okay, and hey, thanks for letting us serve you as your Medicare broker. So you start Medicare
4/1.
4/1?
April 1st.
Okay, you got
Yep.
you have
Actually, a guy named Josh helped me out. I believe it's that is his father-in-law. And
yeah,
mine.
Exactly.
Yeah. It's my brother-in-law, his son-in-law. Yeah. So
There you go. Yeah, it was Josh. He did a great job, guys. He really did. He walked us perfectly through it. So.
Well, that's wonderful to hear. So you have your cards. You're all set up.
We're all set up. Yep.
Okay.
Yep.
Excellent.
We got A, B, C, G, J, and all those.
You got the alphabet soup. Okay. Sounds
Yep.
good. Well, thanks for letting us help you. If you have any other questions, please let us know.
Thank you, Brad.
All right. Thank you,
Take
sir.
care.
Yes, sir.
Yep. Bye-bye.
Bye-bye. Welcome to Medicare School Daily. What is your name and where are you calling from?
My name is Diana, and I'm
Diana.
calling from the state of Utah.
Diana from Utah.
right,
We've been getting
Diana.
a lot of calls from Utah lately.
Yeah. Good to have you today. Yeah.
I'm doing all right. How are you?
We're doing great. It's a beautiful day here in Kansas City. It's 82 degrees is the high, so we're loving the first whispers of
Ooh,
spring.
Wonderful.
I know.
Yeah, very, very nice.
Yeah. So what's going on? What's
We're
your
nice
question?
and pretty. Yeah, well, I have a question. I didn't know if there was a maximum out-of-pocket on Part B for Medicare. I've been on it since October, and I've always heard that there was like a maximum like $289 for Part B. Is that correct?
Okay. So when you're saying max out of pocket,
And I want to clarify,
Yeah.
B is in boy, not D is in drug, right? B is in boy.
Yeah, B is
Okay,
a boy. That
awesome.
is correct, yes.
Okay. Well, the way I would look at that, depending on what plan you're on, Diana, are you on a Medicare supplemental plan?
No.
You have an
Are you
That
gonna-
is, and then I have G as in George.
Okay, that's a
Okay, G.
supplement.
Yeah, that would be a supplemental plan. And so what happens on your G plan, the max out of pocket would be one item, and that is whatever the Medicare B deductible is. That's all you're responsible for.
Oh.
Yeah, and that is it. So
Okay.
now let me explain. Last year that deductible was $257. So the max out of pocket last year $257. This year $283. So they bumped that deductible up usually a little bit every year. But your Plan G covers everything but that. So that's the way I would look. I have the same plan. I have Plan G as well. So your max out of pocket would be that. Now here's kind of the rules. That's all providing you're going to see a Medicare provider and you're getting a service that Medicare is going to cover. And as long as those two rules, yes, you are seeing a Medicare provider and you're doing something Medicare covers, then you would never spend any more out of pocket than the $283 this year. Okay, and then that number resets every January. Probably be a little bit higher next year.
So with, I mean, the way you said max out of pocket.
Okay.
So when you have a Medicare A and B like you do with a supplement Plan G, your deductible is your maximum amount of pocket.
That's right.
Essentially. So you can kind of look at it the same
Okay.
way because there's nothing else above that. Right. So you could have $1 million worth of bills if it's Medicare covered, Medicare approved, Medicare provider. That's it.
Right. And, when you think about it, too, Josh, if someone didn't have a Med Sup plan and all they had was A and B, then their max out of pocket would be unlimited.
Yeah.
That's why we're not fans of people having A and B only because the max out of pocket's unlimited. It just keeps going and going and going.
Yeah, you're responsible for 20% forever.
With yours, you have minimal bills. You'll get $283. And I don't know if you've used your services this year, Diana, but what happens is when the doctor files a claim, that's going to go into Medicare first. Medicare pays their part. And again, Medicare doesn't pay anything 100% other than preventive. So they take the balance after they've paid and they send it to the supplemental company. And they know you have a Plan G, so you're going to be responsible for the first $283, and that could be a couple doctor visits. It could be, maybe $283 on a MRI or $283 on cataract surgery, but you pay the first $283. So that means the provider will bill you for that $283. Just depends on what services that you get. So it could be a combination of bills. It could be one bill, but after you paid the $283, you're done.
I have a question. So how does the Medicare, like the annual wellness checkup, play into that, and then anything preventive?
Okay. Well, what would happen then? Medicare is going to be responsible for that 100%. So they're going to pay it all. They wouldn't send a balance over to the supplemental company nor to her.
So if she just had an annual checkup every year, she wouldn't even have to pay that $283.
Exactly. Yeah, we're not obligated to pay the $283. It just means if I get anything, any diagnostic issue, I have an illness, sickness, whatever, and I go to the doctor, I'm going to be paying the first $283.
What's the list of Part B preventive things? Do you know that off the top of your head?
Well, no.
It's
pretty extensive. Yeah, they have lots of screenings.
Okay.
That we have immunizations are part of the Part B preventive now. Shots. Exactly right. Yeah.
Well, it looks like counseling and therapy.
Okay, so
that's interesting.
So now does that start over every year, or how does that work?
Yes, it
does. So if I have already paid $378, so if I've been on Medicare now since October, so now I'm already up to $378.47.
Okay.
So if I'm only supposed to be paying $283, what happens to my overpay or whatever?
Well, let me tell you, you haven't necessarily overpaid. Let's go back. So you've been on since October, so you would have to look at what you paid from October through December 31. That should have been maxed out at $257.
It's a calendar year, January 1st to December 31st.
It resets every January, so now we're starting again. So January 1 moving forward, $283. So last year, $257. This year, $283. So you kind of combine the 2 years together. You need to separate those.
Okay, all right. So it does begin, so it starts over at January. Okay,
exactly
so I did not know that.
Yeah, and Don, I just want to mention
so we're at 283 for
this year.
2026.
Yes,
okay,
ma'am.
Good to know.
Yeah, and you have the most comprehensive plan
so
on the market. You get bills up to 283, and then you're done. So very, very nice. No copays, nothing other than that.
Okay, so I'll have to just keep that in mind. And that doesn't go with that prescription. That would just be doctor visits and
That's true.
Whatever.
Look at it this way. Everything medically. Inpatient, outpatient, the 283 applies, right? When it comes to prescriptions, I don't know what plan you're on, but you have your own most plans have deductibles this year of $615. So that would be totally separate.
Yes. Okay. All right. Oh, well, that helps me out immensely. And your team was great, and they helped me with this. And very, very helpful.
Do you remember who you talked to initially?
Justin Cohen.
Oh, he's so good.
Yeah,
he's so good.
Yeah,
he's got these little jokes he uses, and I just always get a kick out of him. So he's a funny guy.
Yeah, he was great.
Yeah,
very, very, very helpful.
He's truly a pro.
I appreciate everything you guys did.
That's good. Thanks for letting us serve you.
Thank you, Diane. Take care.
Thank you so much. You guys have a wonderful day.
You too.
Bye.
Thank you. Bye-bye.
Okay, so let's take a pause from callers for a minute. Let's hop into our teaching for the day. Again, the topic is if you are already on Social Security, like the caller that we just spoke with, right? And he's turning 65, how does that process look to be able to get fully on Medicare?
All right, very good. So there are many people today. In fact, I think it's 75, 80% of all people take their Social Security benefits before they hit full retirement age. Many do. And so what happens is anyone that started before full retirement age, which today, of course, would be 67, and they're on Social Security, they'll be automatically enrolled into Medicare A and B. There's nothing they can do, to stop that process. And so what happens is Medicare mails them their A and B card about 100 days prior to their birth month. So right now, if someone's turning, let's say 65, today is March, so it's in June. So back up the clock, May, April. So anyone's turning in July, turning 65, they're going to get their card this month, is the point. Yeah, so if you are on Social Security, you're turning 65 in July, your Medicare card will show up in March. And you'll be enrolled in A and B. Now, many people may want to stay enrolled in A and B. They don't have a group plan available. They're not working. Their spouse isn't working. So it's pretty simple. They're going to keep their card because they're going on Medicare. But it is not uncommon for people to not really want to start Medicare even though they're automatically enrolled, and many don't know what to do. So some will just go ahead and stay enrolled. And so my point is that if you're automatically enrolled into Medicare and your Medicare, of course, card shows up, but you do have a group group plan available to you. It could be your group plan, could be your spouse's group plan. And if there's 20 or more employees on the payroll, then you do not have to stay enrolled in Medicare B. If we're on Social Security, we have to stay enrolled in Medicare A. We can't opt out of that, but we can opt out of B. And we encourage people, if you do have a good group plan, to opt out of B. Now, you need to compare first. What's it cost to be on the plan? Do you meet a deductible? What's your max out of pocket? All the things that we would do in comparing our group plan with our Medicare option. But if the group plan is a better option financially, it just makes more sense for whatever reason, then I encourage people to disenroll from B. And the way they do that is they fill out a form called, it's a form 1763. Now that form 1763 actually has three purposes. It can be used to enroll in disenroll from Medicare A if we're paying for A. It's not what you don't disenroll from A if you're already on it. It's also what we use for immunosuppressive medications. That's just when people had a previous kidney transplant, but they've lost their Medicare coverage, but they still need those anti-rejection medications, so they enroll into a plan for Part B medications for their kidney meds.
Can we hang out?
Yeah,
I
sure.
just want to learn about that. So you're saying you could not really have Part A or B and have a separate Part B, like a different type for just immunosuppressive drugs?
Yeah. Well, here's what happens. When people get, now we're talking about folks who are less than 65.
Yeah,
So let's say I'm 55 and I have a kidney transplant. Well, Medicare will cover that. I get to go on Medicare immediately, end-stage renal disease at any age.
Okay.
And so then once I've had my kidney transplant, then my Medicare coverage ends 3 years later. 36. It's over.
Okay.
Unless I qualify for disability.
Okay.
But if I don't qualify for disability, I go back to work. My kidney transplant is very successful. And so what happens, they'll still then, because the anti-rejection meds are so expensive, people stopped taking them and they had problems. So they came up with this program just a couple years ago.
Immunosuppressive.
That's exactly right. So it's totally for those, and that's all it covers. And they have, of course, a premium for that, but it's an excellent value. And so when people don't need those any longer, then they can use this form to disenroll from that same program. So we get out of, when we pay for premium A, immunosuppressive drugs, and then if I want to drop out of B because I go back to work or I have a good group plan that's better than my Medicare option, I fill out the 1763.
Okay.
All right. And so,
I don't know if you want to look at that.
Yeah, and so the main thing about this form is that it's really simple. Of course, there's great instructions, but what I remind people of course, you'd have a Medicare number. You'd put your Medicare number in there, of course, your name. But you're going to notice up here where it says, forgive my vision, this is a request for termination of. So the hospital insurance, the only way you would ever check that box is if you're paying for Part A, 1% of the population.
So let's back up. So turning 65, already on Social Security.
Right.
So how would they use this form?
Okay, that's what I'm saying. So they would check the box here, medical insurance, because that is Part B.
And this is because they have other employer coverage.
That's right.
I don't want Part B.
That's right.
The way you decline Part B.
This is the way you decline it. This is, in other words, you have a good group plan that makes more sense than Medicare.
Okay.
And so you want to drop Part B. And the reason we do this is because if I'm still working or my spouse is and I'm covered by that plan, it's 20 or more, then the group plan pays first.
Yeah.
Medicare's in the second payer position. Yeah. I'm paying at least $202.90 a month. So this drops me out of B, so I have to pay for it.
So they should still stay in A. They're going to have to stay in A.
You're on Social Security, you have to stay in A.
The only way you would use this form to stop A is if you were somehow paying for it.
That's right. Meaning I didn't have 40
Which is
quarters.
Like less than 1%.
1%.
Okay.
That's it. So most people, but the point is, because people have to pay for it, they give them the chance to get out of it.
Okay, yeah.
And so we're paying
sense.
for B, so we can drop it if we don't need it. And we encourage people to do this because, number one, it's a waste of money, probably. They're paying at least $202.90 if you're high income, paying more than that.
Yeah.
So drop off that. And then what happens, the other benefit is, let's say that you or your spouse are going to work for 3 more years, and now you want to start Medicare, then I set my B date then, and then I have my Medigap open enrollment period. I can get any Medigap policy I want.
Okay,
Yeah,
so they're going to suspend Part B, right, if they don't want it.
Yeah, that's right.
How do they get back into it?
Okay, well, what's going to happen, first off, I want to clarify. So we fill this form out, and then the date you want to end is when, if you have immediate coverage, ASAP, end it. But the important thing is in the comments section, be sure to tell them why. You're doing this because I have a group plan that's available to me. And so we send it into a local Social Security office. They drop off the B. They'll send you back a new card. You'll have Part A only. Okay. And then now we're going to work 2 more years or 3 more years, and then you're going to come in using the special enrollment period. And the SEP process is different than the initial enrollment period, and it just simply means we have to verify credible coverage. So for those of you that don't take Medicare at 65 or disenroll from B, as we're suggesting here, you can come back into Medicare very easily as long as we prove that you have somebody, it could be you or your spouse, has been working, covered by a group plan, back to age 65. And so if you're going to retire at 67, so we got to go back 2 years, verify credible coverage, and then Medicare allows you to come in.
So you can qualify on your spouse's.
That's exactly right.
Insurance.
That's right.
So it's not doesn't necessarily have to be your own insurance. You qualify as long as you're on your. And if you think about this, it makes sense, right? Mm-hmm. Why would Medicare penalize you for staying on a group plan? They want you to stay on that group plan for forever.
That's right.
So that is I think a common myth we hear is like, oh, if I don't sign up for A and B at 65,
there are going to be problems
right. down the road.
Yeah, not if we have a group plan. Not at all. Yeah. So the whole point in doing this really is knowing that why would I want to waste 202.90? Why would I want to jeopardize my Medigap OEP?
What is that?
Medigap OEP stands for Open Enrollment Period, and this is a 6-month window tied to the B date of Medicare where I can get any supplemental plan of my choice, of course, based upon my age. Yeah. And I can do that without any underwriting. The companies have to cover my pre-existing conditions. They cannot charge me extra because of any health issues. So it's the best time to buy a Medigap policy.
Makes sense.
Yeah.
And so that begins on your Part B date.
That's right. Yeah. Okay. So if I don't really need Medicare at 65, though I'm automatically enrolled, I would disenroll from B, pick up B at a later date, and then I set my clock for the Medigap OEP.
So that special enrollment period, I know there's a couple documents. Let's walk through those. Okay. So this is, you decline Part B. You're automatically enrolled. You declined it using this form. Now you're retired 3 years later.
Right.
What's that process?
Okay.
What are those forms?
Okay. Well, the one is called an L564. And let's say it was my spouse that was working that had me covered. When I fill out the L564, I'm the applicant and my spouse is the employee. Yeah. And so you'll see that on the form. And then if both spouses are doing it, one is the applicant and an employee. So the HR department has to verify that we've had credible insurance, someone has been working, and as long as that's the case, we prove that back to 65. And sometimes people change jobs after 65. Well, that just means we have to have two L564s. I've had as many as 4, with a client. So
because there can't be any gaps.
No gaps in coverage whatsoever. And
then they fill out the L564. That's what's called the Medicare Request for Employment Information.
Right. This is how we verify credible coverage, and then we fill out another form, which is not, the employer is not involved in this form, and it's called the CMS 40B. And it's just a form that basically is doing this, telling Medicare this is when I want to start. So my group plan ends, June 30th. I want to start Medicare July 1. On my 40B, I'd say please begin Medicare B July 1. And so I pick the date. Another key to this whole process is not doing it too early. This should never be done any more than any sooner than 90 days of when we want our Medicare to begin. I learned that the hard way years and years ago. We sent it in about like 4 months in advance, and they don't process them. Yeah, I'm telling you, they did not process it. So we never do this any sooner than 90 days. So people ask us all the time, when do I start? That 60 to 90 day window of when you know you're going to retire and your group plan ends, that's when you want to do this process. And we do it for people, and you know that, all day long. So if you need help with this, we're happy to complete all these forms for you. Initiate them. You, of course, have to get it to your HR department, but we can take care of making sure it's done right and it's done on time.
Okay. Yeah. Guys, if you want to be a part of today's show, call in 833-824-2004, 823-2004. Medicare questions, Social Security questions, any questions you want. We're here to walk through your situation and help you find some clarity. So this is a live stream, but we will scrub all of your personal information, so you don't have to worry about that at all. I did also want to say, if you need help with enrolling into Medicare, or enrolling into a Medicare supplement plan, comparing those different options, whether it's a Plan G or a Plan N. What are the different carrier options? What do they cost? Which one's maybe going to be most price stable? Looking at Advantage plans. We were talking to someone yesterday. She lived in Michigan, and I think she had 58 different Advantage plan options. So and a lot of people say, why do I need to use an insurance broker? Here's why. Generally speaking, as people go through their life, they're on employer coverage, right? And so that employer, we do it here at our company. There's 3 options. 3 or 4 options. I think 4 options you can choose from. benefits broker comes in, talks everyone through their options, and then they kind of choose the plan that makes sense.
Check the
4
box.
options, right? When you go on Medicare, you've got supplemental plans, right? So there's probably, there's 10 of them, but most people choose maybe 2 to 3 different options, but they're offered by 15 different insurance carriers with 15 different premiums. Lady yesterday, 58 different Medicare Advantage plan options, 12 different drug plan options. You mix all this together, it is quite the matrix of what do I do, and that's why everyone's so confused. And then you add in the fact that there's penalties, you add in the fact that there can be government deadlines, situations you could pay penalties for life, gaps in coverage where, man, I missed an enrollment period and all of a sudden I've got to wait for 9 months to be able to sign up for Medicare. It just becomes this this maze of things to work through. And so, of course, you can call the insurance carrier directly. You could call, 10, 15 different insurance carriers and have them pitch you on why the best plan. But I think the value of working with somebody like us, where we can just lay all your options side by side, is we can easily isolate what you probably shouldn't do, what the bad options are, and then hold your hand through all the red tape of Medicare. So if we can help you, we would love to do that. We've got right outside these studio doors about 100 people that come to work every single day wanting to help people with their Medicare options. Just find clarity. Just hold your hand through this process so you can go from Medicare confusion to Medicare confidence. Because really Medicare is not that hard. Yeah, maybe there's some tricky edge cases, but 95% of people, there's a way to walk through this very simply. And if you're watching this, you're probably in that 95%. We'd love to help you. Our services are free, of course. There's no cost to working with us. We're paid by the insurance companies that are filling up your mailbox. And so our hope would just be to walk with you for life, for sure. So,
I want to add one more thing, Josh, about people that are still working. What we encourage people, if both spouses are eligible for Medicare, what we like to do is we like to know 2 things about your premium. I want to know what is the employee-only price and employee plus spouse price. And I'm seeing this more and more frequently now. The employer, as we do with our people, will pay the full cost of the medical insurance for the employee. But when we add the spouse, well, then there's going to be an additional charge. So employee could be $0, and now the spouse is $500. And so sometimes, even if both are both eligible, we may encourage the employee to stay on the group plan because it's 0 premium. But to go ahead and have that working spouse go on Medicare because Medicare would be a better value. So my rule of thumb is if you're paying any more than $300 a month for insurance, then Medicare may make sense. Now, for high-income people, that could be a little bit different. But for most people, for $300 or more on the employer plan, Medicare will probably be a better option. Okay, probably better insurance at a lower price.
Love it. Okay. We've got a caller on the line, but before we hop to that, I want to just pull up. Guys, we have a lot of different ways you can connect with us. We want to meet you guys where you are. We've got a Facebook group. Hopefully we can splash a picture of that or the link somewhere on the screen. Got a Facebook group. There's about 60,000 people, I think, that are in that group and active every day. We've got employees that are dedicated to answering your questions inside that Facebook group. We also have a live stream that happens every Monday night where you can come in and talk to my dad. Put in your questions. He'll answer the questions every Monday at 5 o'clock Central Time. And Thursday as well. Okay, so there's a lot of live stream options to get your questions answered. But one of the greatest advantages of being in there is there's 60,000 real live people that are on Medicare. So I will scroll through the group and somebody asks, hey, what do you guys think about this plan? And you're going to get 50 replies to that question. Now, you're going to have to parse through those and figure out when someone's just mad about an insurance company or when it's great. But there's a lot of great opportunities for you to discuss and hear actually from real people. Some of them are our clients, some of them are not. Just kind of what's going on out there in the real world of Medicare. So join us there. We would love to see you there. Also, you're probably maybe watching this on YouTube, maybe on a podcast channel. But one of the parts of this show we're going to start doing is pulling up some comments, answering some questions from people who post them. And so we're going to hop to a few of those, and then we'll get to our next caller. So first one here. Bill says, thank you, Medicare School, for reminding me to enroll in a Part D plan even if I presently take no prescription medication because, as I understand it, I'll open myself up to a possible lifelong penalty in the future if I decided to enroll in a Part D plan. I hope I got that right. You want to speak to that?
Yes, yeah. Many people today are tempted to not have a Part D plan, especially if they take no meds or very cheap meds. As a matter of fact, 20% of the Medicare population does not have a Part D plan. And they don't realize, as he did not, that there's some issues with that. The penalties are financial, but really the biggest issue that I'm concerned about when people go without a Part D plan is if their health were to change very drastically. What happens with Part D plans? The most you'll spend, $2,100 out of pocket. If you don't have a Part D plan, what's the most you'll spend? Unlimited. So I take no meds. I'm on a Part D plan. Costs $9.60 a month. So for $9.60 a month, I eliminated the risk if I had cancer or some major health issue going on. I'm not going to spend more than $2,100 out of pocket.
What's the most expensive med you've heard of?
$33,000. Yeah,
a month.
Yeah, a month. It's called Stelara.
Okay,
and
I've heard of that.
Yeah,
Isn't that on TV commercials?
Oh yeah. Now I've got clients on it. That's kind of the highest dosage right now. I have others about half of that, 15,000 to 18,000. But I had a lady the other day, $33,000 was her dosage and frequency on Stelara.
So let's play out a scenario. Let's say you're Bill, and he's like, you know what, I'm not going to get a drug plan, and it's February. Well, I guess we're in March. So he just found out he's got to be on Stelara. What does he do?
Okay, well,
as it relates to this drug plan issue.
Well, if he's beyond 63 days of losing his group plan, and he's beyond 3 months of his IEP,
initial enrollment period, so kind of starting Medicare.
Exactly
right.
Right. Yeah, if he didn't take it within that 7-month window, starting 3 months before, a month of, 3 months after, or he's beyond 63 days of losing his group plan, he can't do anything. And that's the biggest penalty. The penalty is he has now to wait until later this year, October 15th to December 7th. He can enroll into a drug plan that will start January 1. So if he really wants that medication, his only hope is he pays out of pocket, or he can qualify for some kind of state assistance program, or he can maybe the manufacturer would help him.
Let's say none of that's there.
Yeah.
Right. How does he get this med covered? Like
he can't. Yeah. He
until when?
Until January 1.
So when does he enroll in his drug plan?
October 15th to December 7th.
Which is called the annual enrollment period.
AEP, right? Exactly right. So if I go without a drug plan when I should have had one, I've missed my opportunities to enroll into it, I can only add drug plans once a year.
So he's paying out of that pocket, his pocket March, April, May, June, July, August, September, October, November, December. He would enroll in a new drug plan sometime between October 15th and December 7th, and that drug coverage, he would finally have coverage for it on January 1st.
Exactly right.
So that's the biggest risk.
Oh, that for sure.
By far. So he also mentioned penalties.
Right.
So how does a penalty work?
Penalties work this way. Every year, Medicare sets the national drug plan average. Right now, it's about $40. It's $39 and some change. So they establish that national drug plan average. So for everyone that does not have a plan, they pay a penalty of 1% of that average. So 1% would be 40 cents. So for every month I go without a drug plan, I'm going to pay a 40-cent penalty.
So let's say he went without for 5 years.
5 years. It'd be 60 months. So he had to be $30 a month. No, excuse me. It'd be
40. Is it 40 cents times 60 month?
Yeah, go ahead and do it that way.
So that's $24. That's
okay.
40 cents times 60 months would be $24. So is that $24 a year?
Added, no, it's a month. So it'd be $24 added to his drug plan premium for the rest of his life.
Okay, so let's say he lives till he's 90. So he missed the first 5 years, so he's 70. So 20 years, let's just do the math.
Yeah.
So he's going to pay a $24 a month penalty
for 20
times
years.
20 years. $5,760 in penalty. When he probably should just picked up a drug plan for $10.
That's what I said. So the biggest penalty is to not be able to get a plan when you want it, when you need it. That's the big penalty. I need expensive medication. Well, right now, self-administered chemotherapy medications that are covered by Part D are between $5,000 to $8,000 a month. Okay, so what happens? Part B will cover self-administered chemotherapy meds if there's a traditional chemotherapy equivalent.
Okay.
But if there's no equivalent, then it's only covered by Part D.
Aren't.
Oh yeah,
Some
plenty.
of these newer ones.
Exactly right. Yeah. So minimum, that about $5,000 to $7,000 a month. So that's the biggest issue. To need an expensive drug and you don't have a plan to get it.
Yeah. Okay, let's go to the next one. Pat says, can we get a discount on Plan G if we are married?
Okay, yes.
Probably.
There's two types of discounts available. One is called a household discount. That means I'm married or I live with someone. That's usually above the age of 50. And the second discount would be if my spouse is also going to be with the same company. They don't have to have the same plan. One spouse may have a G, one has an M, but if I'm with the same carrier, then they give an additional deeper discount called a multi-policy discount. So that's the way carriers do it. And most carriers have both of those available. Some don't. There are some carriers that it's multi-policy only. So both spouses have to be with them. But yeah, of course, we're brokers. We write for lots of companies, so we always try to get as many of the discounts as we can for our clients.
Sounds good. Okay, question for Medicare School only. So where is this platform to compare options? Okay, so let's walk through that a little bit. So probably the number one platform for reviewing drug plans is going to be Medicare.gov.
Right.
So this is kind of a change that's happened in the industry that has frustrated a lot of people. It's frustrated our clients. It's frustrated us because it's taken away one of the services that we as brokers provided for 13, 14 years, which was we had a way to be able to assist you with drug coverage. Basically, all of the insurance carriers have now said, hey, guess what, brokers? You guys don't get to be involved in drug plans anymore. The good news is, there's a silver lining to this. Used to be there was 30 different drug plan options you could choose from. So it was confusing. Now there's fewer companies offering prescription drug plans, and they've consolidated those plans down to maybe they offer one or two different plans. There's not, there's 5 different options from Humana, 4 different options from Aetna, 3 different options from United Healthcare, 4 from WellCare. It's just, there's just fewer. So you can go to Medicare.gov. And we coach a lot of people through this. We put out a lot of content. We do a lot of trainings. It should take you 10 minutes. So for prescription drug plans, go to Medicare.gov. You're going to put in your zip code. You're going to put in your medications. Just start typing them in, and it pops up. Choose your doses. Choose your frequency. You're going to choose your pharmacy, and you can choose a couple different ones if you kind of want to shop and compare Walgreens versus CVS versus Kroger or whatever. And then you click next, and literally that next screen is going to list the drug plans, and the plan that is at the top is probably the plan that you need to be on, 99% of the time, because it's going to sort all those plans by what is going to be my lowest total out of pocket, considering the premium and any copays you pay, right? So those things. So you can feel very confident that that top plan is the plan you need to be on. The only addition to that would be if you're on a plan already and it's annual enrollment period, you're shopping your options, scroll down to see where your plan falls and compare that total cost compared to the top plan. Because it's a $50 difference or a $100 difference over the course of the entire year. That may not be worth switching to a different insurance carrier, right? It just probably isn't worth the hassle of waiting on new cars, setting new stuff up, all that sort of stuff, especially if you're on mail order. So that's great. Medicare.gov for prescription drug plans. Would not use Medicare.gov for Medicare supplement plans. It is very confusing. It's just basically
and not up to date.
Yeah, it's not up to date. It's like a mumbo jumbo of plan options that don't make sense. You're going to have plan A, B, C, D, G, F. I mean, all of these different plans. It's going to have different rating classes that aren't going to tell you which one you qualify for. It's just not a great resource. For
somebody put that together that didn't know the business.
Yeah, they're like, here's data. Look at data. So you generally work with a broker or call the insurance carrier directly. If you work with us, we'd love to help you kind of compare those options. And there are a lot of options when it comes to Medicare supplements. I was looking through our list the other day. I think there's 120 different Medicare supplement providers across the entire country. Now, not all of them are available in every state, but there's a lot of them. And so having somebody that can throw 95% of those away and say, hey, here's the 5 that have a big book, that are going to probably be most rate stable, that are price competitive, that we can get you qualified for. That's the advantage of working with a broker. And then the other thing would be a Medicare Advantage plan. You can use a Medicare.gov for that as well. The only caveat to that, it's pretty intuitive to work through. The only caveat is the provider part is probably the biggest determinant of what Medicare Advantage plan you need to be on. Can you see your doctors? And it's not great at that. So we have a lot of our own tools, brokers like us do, provided by our insurance carriers. We need to go back and we need to double check and triple check to make sure you don't have to change doctors if you change insurance plans. So I would be hesitant of relying on Medicare.gov for being confident that you can switch your Medicare Advantage plan. So we tell a lot of people, hey, go check it out, see if there's a plan that catches your eye, and then talk to us. Let us kind of work through that situation with you to make sure your doctors are all covered. Another thing that is surprisingly hard to find on Medicare.gov is the plan's actual summary of benefits. So they have all this digital data, right? And it shows up on the screen, and you can scroll for 10 years and see all this stuff. But there's it's called a summary of benefits that's produced by each plan, and it's basically impossible to find on Medicare.gov.
Yeah,
and so it's the best way to verify all the information and really understand the information. And so we can get that to you. But that's kind of the enrollment.
Yeah, I agree with you. I think navigating Part D plans through Medicare.gov it's a good tool.
Yeah.
But all the rest,
it's not the best.
Wouldn't do it.
Okay, folks, we've got a few callers lined up, so let's get to one of them. We're ready. Welcome to Medicare School Daily. This is Josh Music and Marvin Music. What is your name and where are you calling from?
Greg from Pennsylvania.
Greg from Pennsylvania. Have we talked to you before?
Not recently.
Okay.
I'm a client.
Okay. Well, thank you for being a client of ours. What can we help you with, sir?
I'm actually calling to help us, my brother.
Okay.
And I'm hoping you can give me some advice on how to advise him. He's currently 72 years old. He's in excellent health. He took Medicare A and B on 1/2019, but that's all he has.
Okay.
Nobody ever told him about supplementing A and B with a Medigap or a Medicare Advantage plan, so he has nothing but A and B. Is there any way he could, and he's saying that he can't afford the penalties that he's going to have to pay if he gets something.
Does he have drug coverage?
No.
Okay.
Yeah, no drug coverage.
Okay. Well, Greg, first off, there really are. Let's talk just about medical first. There really are no penalties financially. The only issue for him, if he would like to have a supplemental plan, is he is going to have to medically qualify to do that. But there's no financial penalty, so that'd be issue number one. But if he doesn't want to afford or can't afford, doesn't want to spend any premium, then he can get a Medicare Advantage plan. Now, the likelihood of
his concern was avoiding penalties.
Okay, yeah,
affording penalties.
Okay, very good. So there's no penalties on Med-Sup plans. He just has to medically qualify. Now, if he decides he wants to get a Medicare Advantage plan, then the likelihood of him doing that right now is slim. He may be able to. We have what we call special enrollment periods. He may be able to qualify for one of those. Otherwise, he can add an Advantage plan later this year, October 15th to December 7th. Now, we write Advantage plans. They're fine insurance, but if he could afford a Med-Sup plan, especially at 72, I would tell him to get one of those.
Do you have his zip code?
16001.
Okay, and while Josh is looking that up, and you said he's 72. And
yes, he hasn't actually. He's in very good health. He hasn't seen a doctor for probably 30 years.
Okay. So,
and the reason I'm asking is if he gets a drug plan, he'll have penalties, won't he?
Yes, he will. He will. So he's been without. Of course, he can't get one now, anyways.
Correct.
He'll be able to get one in 27, 1/1. So that would means he went without for 20, 21, 22, 23, 24, 25, 26, 27. So he went without for 8 years. Yeah. So
we can calculate his penalty on drug coverage.
Yeah, exactly.
Let's do that separately. Greg, do you have a G plan or an N plan?
I have an N plan since I went with an N since there's no excess fees in PA.
Yeah.
Okay, so I just pulled up some N plans for, let me confirm, he's age 72, 16001. So, and again,
correct.
There's no penalties or anything like this for adding a Medicare supplement plan like you have yourself. Probably going to be 120, 130
a month.
Okay. That's reasonable.
Very reasonable. Yeah, absolutely. So 120, 130, and he can't get drug coverage yet until October 15th was when he could sign up, and then the coverage would begin January 1st. But when he does that, he will have a penalty he's going to have to pay.
Right. So it'd be 84 months, so 84% times that 40 is what he'd be looking at.
So we'll tell you what.
Well, that's the thing. He's only living on Social Security right now, and it's about $1,000 a month.
Okay.
And he owns his own home and is paying all the expenses that entails.
Okay.
So he doesn't think he can afford to pay any kind of a major penalty.
Okay, what's not major?
The penalty would be less than $35 a month. And that may be substantial
Yeah,
for him, but
yeah.
that's what it would be for the penalty for the drug plan only. There's no penalty. He can get the supplement plan right now if he's in good health without any penalties. But to add the drug coverage, there will be on top of the premium, which we can look up some premium options for him, the cheapest plan if he's not on meds, there will be a $33, $34 a month penalty.
Yeah. So it's not huge. Now there is one way around that. Has he ever applied for Medicaid before?
He doesn't qualify.
Oh, he does not. Okay, yeah, because they waive penalties.
Now,
go ahead.
We do have a Pennsylvania drug assistance plan.
Yep. Good.
For the elderly in Pennsylvania. I don't know if that would help.
Oh, yeah. Well, what that would help him with is at least it would stop the bleeding now, because if you have that, what happens? He can get a drug plan. What he would do, let me say it this way: he can attempt, and it usually works. So he could go to Medicare.gov, or you could do it for him. And when he looks at the drug plans, whatever one's going to be the best one, then he can attempt to enroll. And when you're enrolling into a drug plan at this time of the year, they're going to ask you, well, what is it that basically says why do you think you can get a drug plan now? We call those special enrollments. And so one of the options is normally a state pharmacy assistance program. You can actually check that box, and then they'll let you get a drug plan at this time. Not all states have them, but if your state does, then that's what I would do. So then he could start that drug plan April 1 and then stop the bleeding. Okay? And so Medicare.gov, pick out the drug plan like Josh was talking about.
The lowest cost drug plan is $6.60 a month. It's called the Humana Basic.
Yep. So you enroll in that plan, and then
we can, like, if you call in with your brother to our office, one of our people can help you do all this.
Yeah.
Like, you don't have to go figure this all out alone.
Do that.
Yeah. And then they can also walk through the supplement options as well. I actually pulled this up. There's actually one as low as $111. So anyway, I think for pretty inexpensive. And what's the risk, right? Dad, what's the risk if he doesn't do this?
Yeah, huge risk.
Yeah, I'm just trying to talk him into looking into the future, because he's healthy now, but who knows what's going to happen tomorrow.
Yeah. Well, just so you know, statistically, there will be over 1 million people this year that are Medicare aged that will be diagnosed with cancer. I promise you, a little over 1 million people. So I hope it's not him. I hope it's not me either.
Yeah,
I'm not trying to be doomsday here or put fear there, but the reality is, it could happen, and then it's very, very expensive. And the bad thing about his situation with no supplemental plan is he's going to be liable for the 20% of everything that happens, on the Medicare B side. So it can, it's unlimited.
We were just,
I tell him that all the time, and he just shakes his head.
Yeah. Well, help him through it, and get on the phone with him and talk to one of our reps, and we'll do it all for him. We will.
Yeah, he was kind of thinking that the penalties were going to for the prescription drug plan were going to cost him in the hundreds of dollars.
And I would also just suggest, if you can, separate in his mind drug coverage versus getting a supplement plan. Those are two separate things. Those are two standalone policies. You don't have to get both. Mm-hmm. Right. And so, how there's just so many things that can go wrong medically, from a car wreck to falling down to cancer to a heart attack to whatever it is. And none of us expect those things to happen, just like he does. So just separate those things, and maybe you can, because at the end of the day, he can't. Well, he maybe can get a drug plan now through the state. He's probably qualified for a special enrollment period, and our agents can help you do that easily. But those two things can be separate, and he could get this up without even, worrying about any penalties on the drug plan side.
Right.
So
exactly right.
Okay.
So
you're a good person. You're a good man.
Help him out. And let me share this with you real quickly, Greg. The second largest holder of medical debt in our country, which is $225 billion of medical debt, the second largest holder of that are people that are on Medicare. Why? Because all they have is what your brother has, A and B. and they had some serious health event, and they couldn't pay the bills, and now bankruptcy for and they're with credit agencies are going after their
Medicaid's
money.
taking assets,
Oh yeah, so I'm just saying
spending
to
down
you,
the
he's
house.
really put himself in a real risky position.
But
so.
good news is he's healthy.
Yeah,
He doesn't have to
is great.
continue.
Yeah,
So-
but
Yeah. Well,
Okay, hey, Greg.
when he told, okay, go ahead. Hey, I'll let you go then. I appreciate all your help. You guys take care of yourselves.
Take
Okay.
care. Appreciate it.
good talking to you, Greg.
Bye-bye.
Bye.
Welcome to Medicare School Daily. What is your name and where are you calling from?
Carol Keene.
Carol?
I'm calling from Culver City, California.
From Culver City.
All right.
Welcome.
Good to have you, Carol.
What's your question?
Okay, I have a question about a problem that I have right now with a bacterial infection all over my body.
Oh,
It's called pseudomonas luteola.
Okay.
And basically, it's gone to the to the part of my body that's it goes everywhere, but it originally wasn't going to my teeth, but now it is in my teeth, in my mouth. It's covering my teeth. And I want to know if the insurance company, there's something I should do with the insurance company to get them to cover this as a medical problem,
Okay.
for medical purposes.
Sure. Well, I do know that Medicare does cover medically necessary oral issues. And so it could be that Medicare may cover this, and please, I hope they do, and I'm not saying they will for sure, but whatever provider that you're seeing for this, have you asked them yet if they think Medicare will cover it?
They don't seem to be concerned about that. They just seem to be concerned about whether there's dental insurance or not. That's all.
Okay.
Do you have dental
Yeah.
coverage or a dental plan?
Very little. It's only getting something after the tooth has already had a cavity and then
Okay,
put back together.
Do us a favor, real quickly. Can you spell? I'm gonna do.
I know, I got it.
You got it up. So what's it saying?
We're just
Pardon?
going to pull up a couple things. Hang tight.
on just a second. We're just going to read about this. Did you put in there? Does B cover this?
I mean, yeah, let me see. Give me a second.
Yeah, just ask. Whenever I'm in doubt, I like to, of course, search online to see if B covers a condition. I've never heard of this before.
Yeah, it's called pseudomonas luteola.
Okay.
I already have a lab result for it.
Yeah.
I mean, only if it's considered medically necessary
Yeah.
medical care, which I don't know how it couldn't be.
Yeah, I would. Let me ask you this: are you just seeing like a general, practitioner dentist, or are you seeing a specialist?
General practitioner dentist, and they don't seem interested because I don't have the dental insurance, which was my next question: is
Okay.
how do I, in the future, how do I get the dental insurance?
okay.
I don't even know that.
Yeah. First off, here's what I would do, and honestly,
Okay.
I rarely recommend this, but if I were in your position, I would call Medicare. I would call the main Medicare 800 line, and you may have to be on hold for a while, but I would ask them about this to see if this would be covered by Medicare Part B.
My guess is it is. You're going to have to find
Yeah.
a dentist that is willing to bill Medicare, too.
Exactly right, and the way that would work is if maybe an oral surgeon, because I know sometimes oral surgeons will take
What's
Medicare.
your zip code?
90230.
Your regular dentist is probably has no relationship at all with Medicare, so that's why only the other concern about is dental insurance. But if you can find someone that did accept Medicare,
Okay, I'm gonna give you a couple names. You got your pen and paper?
Yes.
Okay, so I just did a quick Google search. Some of these may end up nothing, but it seems like there's a few dentists in Culver City that are what would be like more Medicare friendly. Look up Fuller Smiles.
Okay.
Culver City Smiles Dentistry. I'm gonna give you one more. Dentex Dental Specialty Group. Dentex, Dentex Dental Specialty Group. It seems like they're a little more Medicare friendly just based upon stuff on their website and stuff, and they may be able to have a little bit of like, oh yeah, we can work with that.
yeah,
Because you want them to be able to bill Medicare and that it be considered medically necessary.
That's right.
So, okay, and this is outside of my regular medical insurance?
This would be on your. Do you have a Medicare supplement plan? Or what do you have? What are you covered by?
No, I just have a regular plan with WellCare by HealthNet.
Okay, so she's on a Medicare Advantage plan.
Yeah, is that
Yeah.
right? You are on an Advantage plan?
Yes.
Okay.
So could she? All right, I'm trying to think.
Well, here's if it's medically necessary and covered by Medicare, then she would have a right to expect that WellCare would pay for that.
Yeah.
Yeah. And
So have you talked to WellCare about this yet?
No, because
Okay,
I didn't want to ask.
yeah.
They know I have the condition, but they don't know. Just recently, is about the last 3 weeks, it's gone to my teeth.
Yeah. What?
So I haven't talked to him about it because I didn't know what to say. I didn't know how to coach
Okay.
him.
What is your? I'm just gonna look up one thing. Do you have your insurance card?
Oh, I do, but I don't know
So,
if I can get it real quick.
Yeah. What I was gonna do. You're in
I
California.
can call it in.
Yeah, I was just gonna look in California if there's a way that I could see. Is it a PPO plan? Do you know?
I think it's an HMO. plan, but I'm
What
not-
was your zip code again? I'm sorry.
90230.
90230. Okay. Continue. We'll just go with that one. I'm gonna see if
Part in my purse.
I'm gonna just put. Let's see. Dental. That's more medical. Acute.
I'd have to
dental.
look around for the card.
Called acute
know.
dental.
Yeah. Okay. I'm gonna give you. Don't worry about it. I'm gonna give you 3 people. That I got one. So it's. You may have to travel a bit. There's one in Anaheim, one in Long Beach, one in Burbank. That are
Okay.
within the WellCare Acute Dental Network. Okay.
Okay.
So the first one is Tony, Tony Chi, CHI. Tony Chi.
You got a phone number there?
Phone number 562-376-5471. Okay, then there's a Michael Blum, BLUM. Michael Blum,
Okay.
714-772-2200. And then this last one's a little difficult to spell. I'm not even gonna give you his last name because it's his name is Raffi, RAFFI,
Okay.
and his phone number is 818
Okay.
842 7999.
Okay.
Call those people. They say they bill WellCare. Tell them what's going on, and I think that'll probably be your best. I think those 3 are probably better than the first 3 I gave you. Okay.
Now, also,
I mean, you could try the first 3, but I think this is probably your better chance.
and if you end up calling WellCare and they kind of stiff arm you, then I would call Medicare to find out would original Medicare cover that, because if so, then WellCare has to cover it. You may have some pushback from them, but you have an appealable situation there. If Medicare says no, this is something covered by original Medicare, they're supposed to match that benefit.
Okay.
So
Okay. Cool.
We have to go. We've got another caller lined up, but thank you so much for
Okay,
calling in. We appreciate you, Carol. Thanks.
take care, Carol.
Take
Thank you
care.
very
Best of
much.
luck with that. Truly. I know
Thank
that's
you
a
very
very
much.
rare
Okay, bye-bye.
thing. Bye-bye. Hello. Welcome to Medicare School Daily. What is your name and where are you calling from?
My name is Stuart Weinstein. I'm calling from West Palm Beach, Florida.
West Palm Beach.
Good to talk to you, Stuart.
Nice to talk to you. What can we do for you?
I have 2 questions. I've been living in Australia for the last 10 years. I'm here in West Palm Beach for what could be a temporary stay or it could be a permanent stay. I haven't decided yet.
Okay.
But while living in Australia, I never filed the Part B, so I have a penalty situation, I think.
How old are you?
73.
73. Okay. When did you? Okay, so you've lived there for 10 years. Okay. Okay.
Yep. And so I'm here now and uninsured.
Okay.
I could be here for another month. I could be here indefinitely.
Yes, sir. Mm-hmm.
So I'm uncertain about when to start the coverage because I'm concerned about the medical underwriting.
Okay.
I have a depression experience.
How long ago?
So
go ahead.
If I go back to Australia, then I have to, and I elect to take the supplement G now so that I'm covered while I'm in the U.S. I'm either going to have to let it lapse when I get back to Australia or continue to pay it because there may be a time where I return to the U.S. Now, if I let it lapse, if I were to come back to the U.S., my question is, other than the medical issue with depression, which may preclude my getting on the supplement G, is there a medical exam for the Advantage programs?
No. Hey, do us a favor. I want to stay on track with you. So have you asked all your questions, Stuart?
No, I haven't.
Okay. So let's go ahead. So ask your other question as well. So we can write these down and we'll address them. Go ahead, sir.
Again, it's when to pull the trigger on the Part B, and it's the penalty that I'm looking at for having been in Australia.
Okay.
Those
good.
are my two.
Okay, that sounds good. Give me your month and year of your birthday. Month and year of birth.
March 53.
March 53. Okay, so you've been in Australia 10 years. Did you work there? And did you were you working there or just totally retired?
No, I was working there, but I did not have coverage.
Oh, no insurance at work.
Right.
Okay, that sounds good. So you were eligible then for Medicare 2020. I mean March of 2018. So we're dealing with penalties all the way through this year. So we're talking really 8 years that you have not had Medicare and you were eligible for it. And so if you decide that you do want a Medicare B, you have to act this month. You only have just a couple weeks to get this taken care of because you only qualify for the general enrollment period, which is the first 3 months of every year. And so what's going to happen is you're going to have, let's see, you're eligible then. Let me count it out for you real quick. It's going to be 19, 20, 21, 22, 23, 24, 25, 26. So that is 8 years. So you're going to have an 80% penalty added to the 20290. So 80% of that, Josh, whatever that would be.
$363. So about $160 a penalty.
Yeah. Okay. So your Part B is going to the Part B premium is $202.90, and you're going to have an 80% penalty attached to that.
How long does that last?
Okay, but let's back up. So it's full 12 months. So he could have started 3. He didn't have to. He had 4, 5, 6, 7. So I think you're not going to have a full 8 years. I think he's going to have 7 years because it's a full 12 months. So let's go 70% penalty. Hey, Stuart, could you turn your radio off or something?
Yeah, I think you got. Are you on speaker or something?
I'm on speaker.
Oh yeah, okay, if you turn that off, we're just getting a lot of feedback.
If you wouldn't mind, that'd be great. Okay, just 70%. Okay.
343.
Okay, very good.
140.
All right. So what you're looking at, Stuart, is $140 a month premium penalty on your Part B. Okay, $140. Okay, there will be no penalty at all for your supplemental plan if you decide to go that direction. And my next question is, you said you may go back in a month or you may go back what? What's the minimum time you're going to be in the U.S. is a month. What's the maximum time? Could you end up staying here the rest of your life?
It's possible, correct, yes.
Okay. So what I would do, and the issue with depression, there are some carriers that if you take in depression medications for 2 years or longer, they won't approve you. But most carriers are not concerned about that. So beyond the depression, do you have any other major health issues, heart, lung, liver, kidney, cancer, diabetes, anything like that?
Prostate.
You have what?
I have an enlarged prostate that could be, I am monitoring it. I don't believe there's cancer there, but there may be. But I'm just on a monitoring program. I'm not going in for a biopsy.
Okay, let me ask you this: Have you had any PSA test above 6 or 6.5 above that?
Yes.
You have? Okay.
Yes.
Okay.
Are you back on speaker? It's just we're having a really hard time hearing you.
I can't seem to get it off the speaker. I apologize.
Oh, that's all right. It's all right. Okay, so here's what I'd recommend doing. This is exactly what I do. With this prostate issue, it's very hard for you to probably get a MedSup plan. So what I would do is this. I would enroll in B right now, as long as you can afford the penalty, and then let us help you find a Medicare Advantage plan that at least it'll reduce your risk and give you some good options. Okay, we don't mind trying to get you through underwriting, but I'm just saying to you, with those PSA tests that high, it may be hard. But we'll go to bat for you if we can. But if not, it's still better to have an Advantage plan than just have A and B only. We can find an Advantage plan in Florida. They're very attractive down there. You can get a zero premium plan, and then you can go ahead and keep that. Now, what's going to happen is this. If you do go back to Australia and you relocate permanently there, then your Advantage plan is going to terminate within 6 to 9 months anyways. But if you do come back to the States, then since you already have A and B, then you can always get enrolled into an Advantage plan when you return back to the U.S. So to me, I think that makes more sense.
Now, let me interrupt. Can I ask you a question?
Yes, sir.
I'm off the speaker.
Okay.
You said to stay away from the SUP. If I go into the supplemental plan between now and the end of March, I'm going in without a medical exam, am I not?
Okay. You know what? He's right, because we're gonna start B.
Oh yeah.
4-1.
True.
My bad.
Wow.
Hey, Stuart. Good call. You're exactly right. And I'm really sorry.
You're looking for a job. We're looking for a new radio host.
Yeah, exactly right. Yeah. Anyway, so you're exactly right. The clock sets. I wouldn't even think about your B date being 4-1, but it is. So there's no medical questions. You can get whatever you want, sir. For sure. In fact, you can.
So I can pay for. Let's say at best, I can pay for 6 months on the G.
Yeah, what's your zip code?
Yeah.
Did we get that?
Yeah, Josh will look it up for you real quick.
33401.
33401.
And then what's your month and year of birth?
It's March 53.
March 53.
Yeah,
okay.
and I'd tell you, Florida has G's are pretty high, so you may want to look at an in plan.
Yeah.
Still be, and you can go with whatever you want.
The lowest G rate is 162.77.
162.70. Is that a good carrier?
Yeah.
Okay. Okay. Good. We got 162.77 on the G, and what's the in?
Your
plan?
lowest in is 111.44.
Okay, so about $50 difference. So that's not bad. I honestly thought it'd be higher. So I think that's good, and there would be.
Can I ask you another question?
Go right ahead, sir.
Can I ask you another question?
Yeah.
Will I have the penalty with the supplemental plan?
No, sir. There are no penalties on SUPs. You're just paying for a 73-year-old age. That's it. No penalties at all, I promise.
Good. Okay.
And you can get it too. My big bet on that one.
So your Part B is going to have $140 of penalties.
Right.
You need to do that by the end of the month. Mm-hmm. Once you get that in place.
Oh, good. So I will have a penalty. So I will have a penalty if I go with the supplement, because that'll be the penalty will be on the B.
For Part B, just to do basically anything, you're going to have that Part B penalty.
Right.
Whether you go with an Advantage plan or a supplement plan, doesn't matter.
Yeah, to get back at Medicare, you have a penalty. Yep. Exactly right. So,
Gotcha.
So we're
and to confirm, you have 40 quarters of U.S. I mean, do you have 40 quarters paid into Social Security?
Yes.
Okay, yeah. So then Part A is free. So then Part B has the premium plus that penalty. You can get a supplement plan, no penalties there. And you're gonna be able to get it with no health questions asked. So you need to get after that. Mm-hmm. Then the other component.
Okay. Can you review with me now? If I go with the Part B and the penalty, what's my Part B penalty?
About 140.
About 140. So your B is $202.90. Call it $203 a month plus 140 penalty.
What's the 203?
That's the base. That's the base.
B.
That's what everybody else is paying for B.
Okay. So that's 20 what?
202.90.
Okay. So I'm at 340.
You're 343.
340 for B, and then you got your supplement plan, which if you go with the plan ends 111, plan G's 160.
3.
162.
Yeah, 162.
Yeah, I was rounding. Yeah.
Okay, so that's $500.
$500.
Exactly right.
And then I've got a Part D as well.
Yeah.
Yes,
Do you
sir.
take some meds?
Yes.
Okay. Are they any of them expensive? Or are they all generics?
They're all generics.
Okay. Yes.
And when I say expensive, $60, $70 is the most expensive generic.
So here's what I'm going to do. We don't have the time to really go through each of your individual meds. If you call into our office, one of our agents can do that
Great.
with you and kind of recommend
Okay.
a drug plan for you. But the other thing you need to be aware of is you also, I believe, unless I'm misspeaking, you also went without drug coverage for 7-8 years, right? So
Yeah, I'm
you're
going to have the penalty on the drug coverage.
Yeah, which will be $30, $33 somewhere in there.
Basically, look at this. For every year you went without, it's going to be $5 a month.
Yeah.
That's the good
Gotcha.
number. So you went without 7 years.
That's 35.
That's $35. So you can get a drug plan for.
And what's a general Part D? Can
Yeah.
you give me a
Well,
ballpark?
Oh yeah, he can give you the lowest one.
I'll give you if you're just on generics, most people go with maybe a WellCare plan. And in Florida, in your zip code, in Palm Beach, it's 0.
There's no premium.
There's no premium. So
on
they
that
have
drug
2
plan.
0 premiums. I mean, there's Humana plans there's one for $25, but
If the 0 works, that's what we'd put you on.
Yeah, for sure.
Yeah. And so I
Right.
think we'll have our producer send you a text, and you can go on that link and set an appointment.
Yeah, we can
We'll
walk
help
you through all that and do all the paperwork and all that stuff, so you get it
Will
done.
there be a penalty? Will there still be a penalty on the Part D, even though there's a 0 premium?
Yes, sir. It'll be 0 plus the penalty. If it was a $10 premium, it'd be
Plus the
$10
penalty.
plus the
Gotcha.
penalty. Exactly right. Now, listen, Stuart, this is critical. You got to do this before the end of the month because this is the last.
I get
this is the general enrollment period. It terminates 3/31. So I'd get right on it, sir.
Now, is there any exceptions that I could qualify for?
Well, unless you qualify for Medicaid, there's exceptions for all this if you have Medicaid. Now, if you have Medicaid, you also can't
Yeah,
get
but if I get Medicaid, I can't go with the supplement. Can I?
Exactly right.
Right.
That's exactly right. You'd have to go with an Advantage plan on Medicaid.
An advantage.
Yes, sir. Yeah.
Right. Okay. All right, you guys have really helped me out. Appreciate it.
Well, hey,
Thanks, Stuart.
we're
Appreciate
thrilled to
it.
do it. You have a good rest of your day, and give us a call. We'll help you, get this process completed, sir.
Terrific. Thanks very much.
Okay.
Yeah, take
Take
care.
care.
Good talking to you.
Okay, guys, that does it for today's show. Thank you for joining us. We will be back again tomorrow. Take your calls, do some Medicare education, share some stories, and
And tell them the number to call.
yeah. Call the number. Write this down: 833-824-2004, 833-824-2004. Love to chat with you, hear about your situation, and hopefully offer some guidance. But thank you guys so much. We will see you tomorrow.
All right. Have a good rest of your day.